Hey everybody, welcome to Aspiring CRA Q A. It's the second day of 2023. Can you believe it? I can't. It seems like the time flew by, but I always forget. Let me make sure everybody can hear me. So type 1 in the comments if you can hear me, type 2 if you can see me. But welcome, Happy New Year. It's 2023. A lot of people like to, do New Year's resolutions. Some people, I see Mars. Hi, Mars. Some people are like, they feel like, New Year's resolutions is cliche and things like that. Hi, Lynette. But no, I feel like if Octavia, Walisha, Mars. Hey everybody. Thank you for letting me know you can hear me and see me, and thank you for joining me. But don't let anybody tell you shouldn't be making New Year's resolutions or it's outdated or any high Carmen, any of those things. It's all still relevant. Whatever floats your boat, whatever helps you achieve your goals, change your habits, whatever you're working on. If you need to set a resolution, set it. Don't let anybody tell you otherwise. So, hi, Laura. Hi, Walisha. Happy New Year, everybody. Kuldeep. Hi, everybody. Thank you so much for joining me. Hi, Brady. And so go ahead. You already know, for those of you who've been joining me for a while, you already know, drop your your questions in the comments. Today is all about you guys, and I want to answer all of your questions, right? So drop your questions in the comments. But hey, everybody, welcome. And before we get into the questions, I do want to do a tad bit of training on the topic of that you already have the skills that you need. You're already ready to transition into that CRA role. And of course, I might only be talking to certain people that might be listening right now, but you can still gain valuable knowledge and information from this. So I just wanted to point out the fact that I have several people over the last, it's kind of pretty much consistent across the board, but over the last few weeks, it seems like a lot of people who are truly qualified to be a CRA, to transition into that CRA role, who are really, really ready, have been reaching out, and they feel like they don't have enough experience. They feel like, or maybe they kind of think they do, but they're not 100% sure, or they're questioning their experience level, they're questioning their position, they're questioning where they're at, right? And some of these people are study coordinators. I had someone that reached out today that was a regulatory coordinator. There's data entry coordinator people that reach out. There's in-house CRAs. There's a wide range of people who clearly have some strong research industry experience. They're already clinical research professionals, and they're reaching out and they're like, oh my God, I don't know where to start, or I need more experience, or can you help me because I feel like I'm missing this or I'm missing that, or, well, what am I missing? What do I need? Well, I'm here to tell y'all that you are not missing anything other than knowing how to brand, market, and sell yourself. And simply put, branding, marketing, selling is just letting people know what you're about, showing them that you have what they want, what they need, and then attracting that attention to ultimately get them to hire you to, work for their company, work in that CRA role. That's literally, simply put, of course, it's very simply put, but that's all it's about. And some people are like, yeah, Jasmyn is simple, but it's not easy. That may be the case, but when you break it down to that very basic level of understanding, and that is just simply grabbing the right attention, well, first letting people know what you're about, which is, I want to be a CRA, I'm ready to be a CRA, and then grabbing their attention to the point where they're reaching out and that's literally what it's all about. So that's, hopefully for the people that are still in limbo and they're like, oh my God, I don't know. I don't know if I'm ready. I don't know if I'm prepared. Hopefully this will help you feel like, okay, I do have what it takes. So I wanted to go over what I call the CRA gateway skills. And I did a podcast episode on this. So I'll drop the link in the comments when we get done. If I can, I'm trying to see if I thought I had it up, but I guess not. So I'll drop the link in the comments. But I wanted to go over the CRA gateway skills just to remind you guys of the types of skills that recruiters, companies are looking for when they are hiring people for these CRA roles, right? So the CRA gateway skills is a term that I, came up with. You're not going to find this anywhere, but it's the skill set and type of experience that companies are looking for in potential CRA candidates, because these are the type of skills that typically determine whether you'll have a strong enough foundation to be successful in the CRA role or not, right? So these are like and I broke them down into 10 different categories. This is not an all-inclusive list, y'all. Keep that in mind. So you may or may not have some of these skills that I'm going to bring up, but you may still be qualified to, transition into your next CRA role. And I see Adekunle, I see your question. I'll get to it just in a second. And everybody else, please go ahead and drop your comments. I'm going to go in chronological order of the order that they're received. So go ahead and drop your questions in the comments. I want to make sure I get a chance to address everybody's questions today. So the gateway skills. So the 10 categories. So the first category is the trial master file, investigator side file. Some people might know it as the regulatory side file, and then the essential documents that encompass both of those files. And it's essentially just the trial files, all of the regulatory documents, all the things that are required from a regulatory standpoint, FDA standpoint, if you're in another country, another regulatory agency within that country. It's all the documents that are required to show that everything at this particular site for this particular trial is being conducted correctly. The patients are safe. There's no misconduct. There's no fraud, right? If you have any type of experience, and when I say any, hear me when I say any, you don't need 10, 15 years. When I bring this up, a lot of people say, yeah, I have some experience. I only did this one little thing or that one little thing. So they don't feel like they've done enough to qualify and say, oh, I have experience in that particular area. But if you have any type of experience, that's literally what, that's what companies mean too. If they say, do you have any experience in this area? That's what they mean. Nobody's asking you to be an expert. Nobody's asking you to be a TMF strategist or specialist or anything like that, but literally, do you have experience handling these documents? Because somebody that has even a little bit, tiny bit of experience versus somebody who doesn't, that's like a big learning curve between the two people. And I know it might not seem like that to you right now, because you're like, but this person has this many years and that many years, but it really does make a huge difference. Even if you have a few months over somebody, depending on where you work, a few months could really be like a year. So that's the first gateway skill. Do you have any trial master file, investigator side file, or essential document experience? The second gateway skill is EDC experience. Do you have any data entry experience, answering any queries, any data, DCF resolutions, which is data clarification forms? Do you have any experience with any of those things? That would be the second gateway skill. And when I say any, I'm going to keep saying this because I know there's going to be people out there that's like, yeah, but I only did that one thing. Well, that one thing counts. Like when I say, do you have any experience? I have to keep saying it, because regardless of how many times I say it, I still get the people that are like, but I only did that one thing. So, and I see your question, Maris, and let me know if I'm pronouncing your name wrong. Is it Maris or is it Maurice? I think it's Maris. Let me know if I'm pronouncing that wrong, but please continue to drop your questions in the comments. So any experience, hear me when I say any EDC experience, that counts too. You're ready. The third gateway skill, any type of patient interaction, any type of subject visits that you've participated in. Maybe you didn't do the whole thing, right? Maybe you didn't conduct the whole visit, but you participated in it. That counts. That counts as experience that they're looking for. Maris like Paris. Okay, perfect. Thank you, Maris. The fourth gateway skill, adverse events and serious adverse events. Do you have any experience with AEs and SAEs? Period. Any experience, whether that be identifying, whether that be asking patients about their any AEs, SAEs during the visit, whether that's entering them into the EDC, whether that is gathering more information about them so that the doctors can assess the if it's drug related or not. Do you have any experience in that particular area? The next gateway skill, number 5, would be ICFs in the consenting process. So informed consent form. The ICF or the consenting is not just a form that people, sign, date, that's it. It's an entire process. It's an entire process that involves more than just signing a form. So do you have any experience in this process, whether that be helping with drafting the consent forms and getting them finalized and approved through the IRB so that they can be, presented to the patient so that they can be signed, or actually conducting the consenting process with the patients themselves, or just being a part of it in any way, shape, or form? That is another important skill that they're looking for, that companies, recruiters are looking for when they're thinking about hiring entry-level CRAs. So if you have that experience, you're ready. Do you have any ICH GCP experience? Same thing. And I lump this also to the category of Alcoa CCEA, which is the acronym that we use to make sure we have, we're keeping in mind the good documentation practices. And I also lump in HIPAA compliance too, all in this one category of GCP. Do you have any experience where you had to ensure or be mindful of these principles, these practices? That counts. Gateway skill number 7, any IP accountability, any IP inventory management, all these things. Janak, I see your question. I'm going to get to everybody's questions in a second. Keep them coming. IP accountability and inventory, whether that is directly handling the drug or the product or the investigational device, whatever kind of study you're working on, or whether it's dealing with the system, the IVRS system, the IWRS system. All of this experience counts, y'all. You're ready. If you have some experience with CTMS system, the clinical trial management system, and tracking important dates or important documents or important visits, what have you, inside of this system, that is relevant experience, y'all. You're ready. Gateway skill number 9. If you have any EMR, electronic medical record system, or source document, any type of experience in that area, where you're collecting the patient information, the patient data, the patient subject visit data, that is all relevant. These are the type of skills that they're going to be looking for in entry-level CRA jobs. And then last but not least, gateway skill number 10, any type of lab experience where you're collecting samples, processing samples, shipping samples. All of that is important. All of that is relevant when it comes to the CRA role. So that is another skill that, if you have that experience, you are ready too. So again, keeping in mind that these are just 10 gateway skills that I came up with, the top 10, but there's so many other skills. There's so many other, experiences that still count, that still qualify you as ready to step into that CRA role. So just keeping in mind, these are just a few. I just wanted to give people a place to start. And these are what I call the CRA gateway skills, the top 10. So with that being said, I see some questions already, so I'll go ahead and tackle those. But drop in any more questions that you might have about anything that I just covered, any of the gateway skills. If you have any questions about what I meant, if you want clarification, if you're like, yeah, but Jasmyn, you don't understand because I have a little bit of that experience and I'm not sure if it's still enough. Whatever your question is, drop it in the comments and we will address it today. So the first question comes from Adakunle. Let me know if I'm pronouncing your name wrong. But I've been applying to CRA positions, but I've never been able to secure an interview. I'm presently a CRC RN. I really need help. Great question. Out of Cum Laude. So if you are a study coordinator and you're a registered nurse, I'm literally talking to you when I just went, when I just did my little rant at the beginning of this. I'm talking to you. You are definitely ready. You're more than qualified to become a CRA, to land your first CRA position. So people that are in your position, typically people that are in your position that I speak with, it boils down to what I mentioned earlier. You just need to work on branding, marketing, and selling yourself. So if you've been applying and applying and applying and applying, and you haven't gotten any interviews, the first sign or the first symptom would be that, okay, well, is something going on with your resume, your branding and marketing strategy? So something is not hitting. There's a reason why people aren't clicking that button and say, let me call this person, let me email this person. There's something going on with that first step of grabbing their attention and saying, hey, I'm qualified. There's something going wrong with that first step. So that would be my advice to you, is that you really need to focus on that first step, which is branding yourself. So really, really becoming known as the person that not only wants to become a CRA, but also that's ready and prepared and has the skills, the expertise, and knowledge to be a successful CRA. So that's the first step. And then the second piece would be marketing, which is getting people meaning the right people, the recruiters, the hiring managers, the companies, getting them, grabbing their attention and letting them know, hey, I'm qualified. I can be a valuable asset to you guys. And that will come with your resume, getting your resume, tweaking your resume. It sounds like you've only been applying. I didn't hear you say anything about LinkedIn. So it sounds like the bulk of your issues right now, anyways, from your current strategy is your resume. Now, on the back end, I will say, well, for my clients, it's really on the front end, is that I really focus on helping people build an entire CRA job attraction system, because submitting applications is the slowest, most efficient way that you can land a job. You ultimately want to land a job by attracting recruiters, companies, hiring managers to you. So they're reaching out to you and they're saying, hey, Adekunle, I see that you are an aspiring CRA. We have an entry-level CRA job open, and we wanted to know if you would be interested in interviewing for the position. That's the ultimate goal, and it's possible. It's doable. It's possible. I did it myself. My clients do it all the time. You just this is where the BMS comes in at, y'all. This is where you have to really focus on brand and marketing and selling yourself. So I would say that seems to be your challenges at Adekunle. And in terms of really setting up that attraction system, I haven't seen your LinkedIn profile, but your LinkedIn profile is going to be your biggest asset when it comes to marketing yourself online and creating that CRA online presence. So that would be my advice to you. So Maris, your question is, and Adekunle, if you have any more questions, or if I didn't address your specific question, let me know. Just drop it in the comments. So Maris says, I'm graduating this August in forensic science, but I have changed my mind on what I want to do. I've been applying to clinical research positions, but it's like I'm not getting a call back. I've transferred my previous experience to a clinical research background. Where am I going wrong? So great question, Maris. I would need a little bit more information from you in terms of like the details about, you said that you've been applying to some clinical research positions, but what positions? Because that's the first thing. I always tell people you have to hone down and narrow down on the specific role that you want to tackle. That's the first thing. And then also, if you're applying to a wide range of positions, because the clinical research field is so wide. I specialize in CRA jobs, but it's so many other positions. And depending on the position, you'll need to tailor and tweak your resume to that position, which is another reason why I always say you got to hone down and focus in on one specific role. And then the next part of that was, you said that you're not getting any callback. So the same thing, the same feedback that I gave to Adekunle, it could be, that's like the first phase of this whole entire process. So if you're not getting any callbacks, you're not hearing anything, I always say you have to check your resume and your branding and marketing, because for some reason you're not grabbing the attention. You're not getting them to say, hey, let me call this person, let me email this person. So it's always going to go back to that. The proof is in the data, y'all. So if you're not getting callbacks, or if you are getting callbacks but you're not getting the offer, you're getting interviews but you're not getting the offer, look at the data. The data will tell you what you need to do next. It will tell you where your mistakes are, where your holes are, where your gaps are, and what you need to fix, and then what you need to do next. So that, the same advice that I gave to Adekunle, that applies to you as well, Maris. And then you said you've transferred your previous experience. So what do you mean when you say you transferred your experience? Tell me more about that, because that will help me to give you a more detailed answer. So what do you mean when you say you transferred your previous experience? So you said my master's in forensic science, I meant, okay, which I got that. And then you said clinical research coordinator associate. So I'm gathering that you're currently a study coordinator. That's what it looks like. And if that's the case, I'm talking to you again. When I went on my little rant in the beginning, Maris, you're qualified. If you have study coordinator experience, you meet the qualifications. Companies literally create entry-level CRA programs for people like you, for clinical research coordinators. They specifically seek out study coordinators because that's one of the top roles to transition somebody into a CRA and know that they'll be successful. And then I see your next comment. My previous roles were a lab tech, pharmacovigilance specialist, and I'm currently a medical coder. Yes. So you have lots of great experience that qualifies you. It ultimately just sounds like, thank you for giving me that extra bit of information. It just sounds like the same issues, challenges that I mentioned with Adekunle. It goes back to the branding and marketing and your resume. I did a resume audit a couple weeks back in December. I can't remember when, but if you scroll through my profile, you'll see the resume audit that I did, and take a look at that and see some of the suggestions and the feedback that I gave on how to, create that CRA resume. So hopefully that helps. If you have any questions, or if I didn't really answer your question, let me know. Drop another question in the comments. So Janak, let me know if I'm pronouncing your name wrong, but your question is there an alternative path for international medical graduates to be a CRA with little experience of CRC on hand? If there is, what is it and how long is the path? So I think thank you for that question. That's a really great question. So I want to tackle that in two parts. The second part I want to address first. What is it? How long is the path? That was the second part of the question. I think that is a major issue with a lot of people, in that, number one, they think that there has to be some concrete path, like there is with medical school, for example, or being a lawyer, or some other career that is like very clear. You take this course, that course, this course, that course. You take this license exam and bam, you're a doctor, you're a lawyer, right? That doesn't apply for the CRA world at all. The clinical research space in general, it doesn't apply to our field. And I think that confuses a lot of people. And not only does it confuse people, but it also keeps people kind of stuck in this place, in this position, because they're constantly seeking some type of educational path, and then they're constantly trying to put a time frame on that path. And you really can't do that. That really kind of stunts your growth, it stunts your success, and impedes your progress. So instead of focusing on how long is the path, focus more so on, okay, I want to be in this field. I want to be a CRA. So I'm going to do whatever it takes for however long it takes. That's the approach that I took. That's the approach that anybody that's successful that I know that they take when it comes to achieving their goals. So you can't really say how long is the path, because if it's 5 years, what does that mean? That you're going to give up? So focus less on how long is the path and more so on the steps that you need to take towards achieving that goal. And then the second part of the question is, what is it? So what experience, or what is the alternative way for becoming a CRA with as little experience as possible? So I get that because, if you've gone to medical school, if you spent that time, that effort, that energy, regardless of whether it's an international degree or not, you're automatically thinking, well, I have the education to support me being successful in this role. And being a CRA doesn't boil down to education or how smart you are, or how many degrees you have, or any of that. It really doesn't. It boils down to a unique, specific set of skills that you can ultimately really only gain through experience. Now, you can sit in a classroom and you can learn all about clinical research and the concepts and how to be a monitor and all those things. But that's in the best case, perfect world scenario. And the reality is that in real life, nothing ever goes the way it's supposed to. So that's where the experience comes in at. And that's the challenge when it comes to hiring newbies, because you don't have that experience. So you can't really maneuver those different types of situations as they come up, whether you have a medical degree or not. You're both still in the same boat of being green, new, and don't know how to monitor a clinical trial. So, with that being said, Janak, there really is no way to speed it up, so to speak. There are plenty of people who go, straight from an international degree straight into a CRA role without being a study coordinator. Some of those people, I will say, that I know anyways, they have a lots of challenges because they don't know what's in the trial master file, the ISF, the skill set that I just brought up, the CRA gateway skills. They don't know a lot of those things. They don't teach those things in medical school, right? That's not a part of the curriculum. So high level overall medicine and those concepts, yes, you're trained on those, but being a CRA is not about that. So you need to ask yourself, do you even want to jump straight into the CRA role? I recommend against it because you don't want to put yourself in a position to fail. You don't want to get in the role and be like, oh my God, this is awful. And all just because you weren't prepared and you didn't want to be a study coordinator for a few months. No one's saying that you need to be a study coordinator for 3, 4, 5 years, but why not at least take that coordinator opportunity and make the most out of it for a few months, gain some experience, and then leverage that to be an even stronger CRA. And then you can fast track your career. With you having that international degree, you can go on to MSL, to project management, to CTM. You can really fast track those steps. Just because you're starting as a study coordinator and moving into a CRA doesn't mean it has to take you 5 years at each role. You can literally fast track your career path. So I hope, Janak, that answers your question. It might not have been what you wanted to hear exactly. But yeah, hopefully that answers your question. If not, let me know in the comments. So next question, Jasmyn. Could courses concentrated in clinical practices help get system and documentation relevant experience? Great question, Jasmyn. So short answer, no. The only way to get experience is to get real life experience. That's literally it. Not to say that these courses can't help prepare you so that you're not completely lost and completely just, stressed out and overwhelmed when you see these different things come up in the job, in the role. But the only thing, there's no substitute for experience. That's why I always try to tell people that have like advanced level degrees or that's thinking about going to get an advanced level degree, there's nothing that's going to trump experience. You're never going to beat that study coordinator that has 5 years of experience just because you have a PhD. If you have no experience, you're just not. There's nothing that's going to trump experience. So with that being said, I'm not going to say don't take the course because I'm always about, increasing our knowledge and education and things like that. But if you have a specific goal, I'm also about doing what's in line with my goals and not just being busy just to say I'm busy and I'm doing things, because I also like to be efficient as well. So if your goal is to become a CRA, I don't know what your background is. I see that you have a PhD, but your goal is to become a CRA. Depending on what other experience you have and what other things you bring to the table, I may recommend against it for you specifically. So I don't give the same advice to every single person because we all have different stories. We all have different circumstances. We all have different situations. So what might apply to you might not apply to the next person. I just have to know more details about your story. So if you already have some type of clinical research experience, I would say absolutely not. You don't need to take that course unless you just want to, increase your knowledge. But if you're taking it thinking that it's going to help you get the CRA job, no. Um, so hopefully that helps. And Jasmine, please feel free to share. Oh, I see you did share more. So you said, I'm a PhD chemist with extensive lab experience, but no clinical background. What are some good ways to break into the industry? Okay. Thank you so much for that extra bit of information, Jasmine. So some good ways for you would be to, and I have a podcast episode on this, but um, the top CRA gateway roles that I recommend are a clinical research coordinator, study coordinator, same thing, clinical trial assistant or clinical trial associate, same thing. I've also seen some assistant CRAs, similar roles, different titles, and then in-house CRAs. Those are the top three, but then there's all these other secondary gateway roles like a regulatory coordinator, regulatory specialist, clinical research specialist, data entry coordinator. There's all these other roles that will still get you that same result. I just recommend those three as the top three if you're starting from scratch, because they help you hit a lot more of those gateway skills, the 10 that I mentioned, just because those roles typically carry a lot of different responsibilities. So for you, Jasmine, if you were working with me and you were my client, I would recommend that we really push for either the CTA or the study coordinator role. You can also push for an in-house CRA role as well. But again, keep it in mind that you coming from that bench science background, which I started out at the bench science too. I started out with going in my PhD program in pharmacology. So I know exactly where you're coming from. And I was thinking like, oh my God, like, of course, no brainer. Like I'm been in this, the top pharmacology program in the country. Of course, they're going to bring me in as a CRA. No. And I'm so glad that I didn't, because I would have been lost and I probably would have quit and I wouldn't be talking to y'all here today because it would have been so overwhelming. So you really do want to take your time and get some experience in one of those roles that I just mentioned. So that would be a good place for you to start. Maris, she said, can you be my mentor? Absolutely. I'll drop the link. You can go to aspiringcra.com and then you can book a sales call with me there. But then I'll drop a link in the comments as well so that you can book a call with me, Maris. I would love to mentor you. Adekunle, thank you. I said your name right. Naomi says, keep networking. Absolutely, Naomi. That is key. Networking is everything. That is a part of branding, marketing, and selling yourself. Networking has literally, I haven't applied to, when was the last time I applied for a job? I think it was like 2013 was the last time I actually submitted an application to land a job. Other than that, I don't apply. I've literally done the things that I'm telling y'all to do. I don't just say them just because I've tried them for myself to see if they work for myself, and then with my clients. I always make sure it works for me first and then with my clients. But branding, marketing, and selling yourself will create things that you didn't even know was possible. I literally have people that recommend me for jobs that I don't know. To this day, I haven't met them. But they recommend me. I'll get an email from the recruiter, a call from the recruiter, a DM from the recruiter saying, hey, such and such referred you. Do you want to interview for this job? So that's the power of networking. Thank you, Naomi, for bringing that up. That's the power of networking, which is all wrapped in branding, marketing, and selling yourself. So keep that in mind, guys. And then let's see. Magdalena. Hey, I haven't seen you in a, well, no, were you here the last time? I think so. Hey, Happy New Year. So Magdalena, your question is, recently I had an interview with a recruiter at Medix company for the CRC position. I was told that the company requires 1 year of research experience. I asked her to discuss with the hiring manager of the company if they would substitute their 1 year requirement with my 20 years clinical experience. My question is, why do they keep asking for 1 year of experience and would not hire for an entry level? Great question. I'm so glad you asked this question. Well, first off, I want to point out the fact that I always tell people, if you've made it to the interview, regardless of what feedback they give you about, we want somebody with more experience, I take that with a grain of salt. And if I'm being real, I don't believe it at all, just because they saw your resume before they interviewed you. So they knew, how little experience you had before they asked you to interview, right? So it can't ultimately, like, maybe that's a part of it, but that's not the determining factor. Otherwise, they would have never interviewed you in the first place. So there's something that took place during that interview, during that conversation, that didn't exactly sit well with whoever you were speaking with, and that did not encourage them to, send you to the next steps, whether that be extending an offer or another interview. There was something that took place in that conversation. Maybe you said something that they didn't want to hear, or maybe you didn't say something that they wanted to hear. Whatever the case may be, I can't tell you exactly what that is in that particular situation, Magdalena, because I haven't heard the whole entire conversation. But that's another thing I always recommend for people, whenever you can, to record your interviews so that you can go back and you can do an assessment. I have a podcast series coming out. It starts Wednesday. It's part 1 on Wednesday. It's a 5-part series, and I cover from beginning to end of the interview, ending it on a real life mock interview so that you can hear a person's response and then my feedback critiquing that response so that you can get a real clear picture on a successful interview response versus unsuccessful. But my advice to you, Magdalena, is that there's clearly more going on to that particular situation than they cared to admit. For whatever reason, people don't always feel being 100% honest with why they're not moving you to the next level, but there was something going on in that conversation that was missing. And regarding your question of why do they keep asking for 1 year of experience, and even though you have these 20 years of clinical research experience, trust me, I get your frustration. I do. I wasn't a clinician like you were, but like I said, being in a PhD, a top pharmacology PhD program, when you have these types of educational backgrounds and this type of experience, you're like, no brainer, right? I should be considered. But it's hard to explain it to somebody who hasn't broken into the industry yet, because you don't know what you don't know. And going back to what I said, I'm so glad that I didn't land my first CRA job green, going straight from the lab to clinical research, because I would have blew it, because there's just so many moving parts and so many moving pieces, and it's just so complex and so complicated when it comes to the amount of things that they expect for you to know, the pace of the industry. It's like everything needs to be done yesterday, right? Not even today, yesterday. As soon as you get on a study, there's a backlog, there's a long list, a long to-do list. And typically speaking, they need somebody that can take care of that list right then and there. Most people are desperate for help, and they want people that they don't really have to train that much, because they're already overwhelmed, they're already stressed, they're already, behind. And so that's a large part, Magdalena, for why, because a lot of times they don't have the resources to train, they don't have the time to train, they might not have the the desire to train, because the turnover rate has been high too. They'll train a person, then they leave. They get another person in, they train them, then they leave. So it's a lot of different, behind the scenes reason that's going on too for why. But again, none of that matters to you, right? When you're trying to land your first role, you're trying to break in. It's just frustrating. It's just stressful, right? I get it. I was there. But trust me, there are ways to overcome that hurdle, that obstacle. The good news is you got an interview, right? So you're doing something right. You see all these other people's comments. Some people are, haven't made it that far yet. So you've gotten an interview. So there's something going on with that interview piece that needs to be tweaked, worked on a little bit. So, stay tuned for the podcast series that's coming up. It'll be releasing on Wednesdays, every Wednesday for the next, there's 5 parts, and then the mock interview is broken up. So the next about 6 weeks or so, every Wednesday, check it out. Confessions of a CRA. You can check out that podcast and tune into the interview series. That should really help you, Magdalena. And then she said she told me that the company is looking for 1 year of experience, but she doesn't know if the hiring manager would make an exception. I was told that she would get back to me through email. I'm still pending their decision. Okay, cool. So you don't even know if you didn't get it. Maybe you'll get it, right? Fingers crossed. Hopefully you'll get it. So definitely follow up on that opportunity. But the good news is you're doing something right. You got an interview, so you're doing something right. So next question comes from Carmen. I am a team lead for a site management group at an imaging core lab. I started out performing Q&A on imaging data that's received for a variety of clinical research studies and just works my way up. So I have a lot of experience working with sites to resolve queries and or troubleshooting, uploading, and qualification issues. I've been doing this for 15 years, but on the other side, not sure I would market myself to transition. I'm assuming that you mean not sure how to market yourself to transition. Is that what you mean, Carmen? Let me know because I want to make sure I have your question right. Are you asking me how can you market yourself to transition into a CRA, or please clarify that question. I want to make sure I get it right. Maris, I see that you said thanks so much for your advice. Absolutely. Janak, Carmen, yes. Okay. So before I go to Janak's next question, Carmen, you said yes. So you have enough experience. Yeah, I figured it was a typo. So you are Carmen, you're one of the people that I'm talking to. When I mentioned, when I went on my little, I don't know if you were here from the beginning, but when I went on my little spiel about the CRA gateway skills and people thinking they don't have enough experience, you do. This counts as amazing, awesome, wonderful experience. You're used to resolving queries, troubleshooting, uploading, dealing with imaging data, performing QA. All those things are things that are essential skills to being a successful CRA. So you're ready to transition. It's just going to boil down to branding, marketing, and selling yourself. I cannot say this enough, y'all. A lot of people, they want to find some quicker, easier way. Like Janak said earlier, like there has to be another way. But there isn't. And the good news about that is that branding, marketing, and selling yourself can be really fun, simple, and easy. It really can. When you take out of the, when you get out of the mindset that, oh God, I got to set up a LinkedIn profile. I got to do this. I got to do. No, it can be fun. Y'all, it can really be fun. It can really be simple. It can really be easy. And Walisha, I don't know if she's listening, but I always bring her up as an example because she's been following me and she literally just takes my advice and like she does amazing. She's created this amazing profile, this LinkedIn profile that has people already reaching out to her. And she's done this all on her own. So it can literally be fun, simple, and easy, y'all. That's the beauty of branding, marketing, and selling yourself. So the same advice for you, Carmen. That's what it boils down for you when it comes to transition over. And you have to be very clear. And when I say very clear, meaning using kindergarten language, if you have to be able, whatever your and even during the interviews, whenever you're talking to recruiters, whenever you're networking, whether it's in the DMs, email, whatever it is, you have to be on that kindergarten level of explaining and really sharing your story and explaining that you have all these wonderful skills that are 100% transferable CRA skills. You have to educate them. You have to tell them, show them clearly yourself. You have to identify and say, hey, these skills count. And a lot of people are like, but why should I have to do that? They should be able to pick that up. Maybe, but is it really relevant when it comes to you reaching your goal? So whether they pick it up or not, who cares? It's the ultimate responsibility is on us. It's on us to take control of our careers. And in doing so, that's where we can get clear on and letting them know, hey, I've done this, this, and this. And all of this is the same thing that CRAs do. So I'm ready. So make sure that if you're posting on your resume, your LinkedIn profile, your about section, when you're networking, when you're talking to recruiters, make sure you make it crystal clear that this is what you've done and this is what's, where it falls into the CRA lane, and this is why you're ready and you're qualified. Let me know if I see your comment, Carmen. You said that's what I figured. I've not had to market myself because I've been with the same. Oh yeah. And a lot of people have been, some people have been with the same company for a while. And that's a beast in and of itself, right? When you're getting back out there and you haven't, had to sell yourself or market yourself in a while. That can be a challenge in and of itself. But you got it, Carmen. If you've been able to create a successful career over these past going on 2 decades, doing what you're doing, you'll be perfectly fine. Just put yourself back out there. And I did a 30 over 30 series where I talked a lot more about BMSing. So check that out. If you scroll through my profile, it's basically in November, I went live for every single day in the month, and I covered a problem every single day. So check that out. So Janak, another question. I've heard some people talking about CRA certification. My question is directed to that kind of certifications. Okay. CRA certifications. Well, I don't want to burst any bubbles, but there's only one truly recognized industry CRA certification. Now, there's a difference between, there's a lot of people that say they have these programs that have these certifications and they say that they're accredited, right? There's a difference between accredited and industry recognized. Accredited just means that they've passed some set of rules or some set of guidelines that some organization has in order for them to say, okay, now you're officially accredited. The industry doesn't care about that. What they care about is industry recognized certifications, which right now, at the time of this this live recording, is offered through ACRP and SOCRA. Those are the two industry organizations that offer certifications that are recognized. ACRP offers the only CRA certification. And in order to even take that exam, you have to have experience, at a significant amount of experience as a monitor, being a CRA, before they will even let you take that exam. So if you're on here and you're asking, how can you even become a CRA? How can you even get some experience? It sounds like you're not even ready to take this exam. So that doesn't apply to you. So don't let anybody else tell you, and not to say that there aren't some great programs out there that say, oh, you'll get a CRA certificate at the end or CRA certification. It might be a really great program, but just know that whatever certification they're giving you, it's not going to be something that is going to be an industry recognized certification that will allow you to put the CCRA letters behind your name or allow you to have some type of leverage when it comes to landing the CRA position. And then I see Magdalena, you said you're in the same situation as Janak. Yeah. And I understand, I truly feel for both of you, but if you two just really focus on branding, marketing, and selling yourselves, you'll be just fine. And then Maris, I see that you have another question. Would you say it's okay to get a CCRC when you do plan on moving to a CRA, or just get experience as a clinical research coordinator, then to a CRA, and then get the CCRA certification? So, for those of you who follow me on LinkedIn, you probably see, okay, well, you got the CRA certification. So does that mean I need to get it? I didn't get any of my certifications, y'all, until after I was a CRA for, I think, maybe like a year or so. And then my companies paid for it. If I had to pay for it, I would have never gotten it. And then I haven't been keeping up my renewals, if I'm being honest. Both of them are expired. I need to, if I want to keep them currently active, you have to keep up with your renewals, which I haven't. Why haven't I? Simply because they didn't give me the leverage that I thought that they would give me when it comes to fast tracking my career and negotiating power that I thought that they would give. So I haven't renewed them. Everything that I do, I try to keep in line with my ultimate goal. So if it's not in line with the goal anymore, it's out the window. And because it wasn't in line with my goals, I haven't renewed them. But going back to Maris's question, is that is it okay to get a study coordinator certification? Yeah, you can get one. That's perfectly fine. But if you have study coordinator experience, because that's the only way the ACRP will let you sit for that exam too. If you have study coordinator experience, then you don't need the certification to get a CRA role. You really don't. If that's something that you want to do, it's just something you're passionate about and it's on your heart, by all means, I support it. But just know that you don't need it to get a CRA role. And then the second part of your question, or should you just get experience as a coordinator, then move to a CRA and then get the CCRA certification? So I would recommend, if you were my client, to just get, you have your experience as a study coordinator, transition into a CRA role, and then I wouldn't even necessarily say to get the CRA certification. It would just depend on your goals. So going back to goals, I bring up certain things a lot because I'm really, they're really important. They're really important. So it all depends on your goals, Maris. I hope that helps. Let me know if you have any more questions. So Natalia's question is, I'm a dental assistant that would love to transition into a CRC, then to a CRA role. Can you give me some feedback if this is even possible? Thanks. Oh, absolutely, Natalia. It's 100% 1,000% possible. There's people that transition. I have clients that have transitioned in from completely different industries, from adult care living, from the financial world, from business marketing world. There's so many different, other industries that people transition into. So you are perfectly fine as a dental assistant. You are, at least you have that medical background. So absolutely, it's 100% possible. And the same applies to you. You'll have to focus on branding, marketing, and selling yourself so that you can get that initial study coordinator role. The same applies to everybody, y'all. Whether you're at the level and you're ready to transition into CRA, or if you're at the level and you're just getting started and you're looking for a study coordinator or CTA, you still have to be able to brand, market, and sell yourself. Regardless of where you're at in your career, if you want to create the career, the life of your dreams, and really take control and take ownership as the CEO, you have to learn how to brand, market, and sell yourself. Unfortunately, or fortunately, some might say it's the only way. Let's see the next question. Jasmyn's question: are clinical certifications needed to break into the industry? And I hope I answered this one a little bit earlier, but absolutely not. You don't need the certifications to break into the industry. And like I said before, a lot of them, you can't even take the exam until you have a certain amount of experience in that role. And just to give you an idea, don't quote me, but I'm pretty sure for the CCRA exam that ACRP offers, it's like I want to say like 3,500 hours, something like that, of experience that you have to have. And then they'll supplement a certain subset of those hours if you've taken like a CRA training course or something like that. But it's still a significant amount of hours that you need in order to take the exam. And I always recommend it because if you've had experience as a CRA, I didn't study for any of my exams, by the way. I just took them because they're designed so that if you truly have experience in that area, though, as much as you say you do, then you shouldn't have to study. So that's how the exams are structured as well, just as an FYI tip. Okay, Adekunle, I will certainly attach the link for you as well. And Maris, Nathan, I see your question. With 8 months of experience, how can I transition from the coordinator role into the CRA role? Same thing, Nathan. Brand marketing, selling yourself. If you have 8 months of coordinator experience, you have a lot of really, really great experience and you're ready to transition, but you have to know how to brand, market, and sell yourself. It's going to always boil back to that. And check out, again, for those of you who don't know what I'm talking about, check out my 30 over 30 series. Just go back through my profile and you'll see, even if you're watching on YouTube, it's still posted there. You'll see all of the videos from November where I talk about what branding is, what marketing is, what selling is, and how to execute on all 3 levels in order to reach your goal. Okay. Definitely the main goal and maneuver from the starting point. Gotcha. Thank you. Okay. Of course, Maris, you're so welcome. Glad to hear I did, Jasmyn. I don't see any more questions, and we're coming up on the top of the hour. So let me know if you have any more questions. I want to make sure I address everybody's questions before, Nathan, you're so welcome, before we leave. But while everybody, maybe there's a few last minute questions while we're getting those in the chat. I do want to go ahead and extend an offer into my 6-month coaching program for those of you who are interested, where I help clinical research professional women confidently land their first job offer, struggle and frustration free, with no monitoring experience or CRA certification, all through teaching you how to brand, market, and sell yourself. So the program includes an initial onboarding call where we will immediately assess and revamp your resume, your cover letter, your LinkedIn profile, everything done for you after that initial onboarding call. And then you'll get 6 months of high-level, private, one-on-one coaching sessions directly with me. So we meet every single week together and we focus on, what you specifically need to reach your goal. And then you'll also get immediate on-demand access to my curriculum filled with all the frameworks, the templates, the checklists, everything that you need to land your first job, your first CRA job. You'll get direct messaging support with me so that we can communicate outside of the weekly coaching sessions in case you need me. You'll get a mock interview with a recruiter, which is recorded. You get an evaluation and assessment from the recruiter. And then myself as well. You also get bonus courses on negotiating a high paying offer and fast tracking your career once you land your first CRA job. And then we also work on creating a CRA career plan for you. So if you're ready to confidently land your first CRA job offer, struggle and frustration free, book a sales call with me and learn how I can help you. Just visit aspiringcra.com. And then I'll also put the link in the comments as well. And then Naomi gave some other good, helpful advice. She said, participate in webinars, chat with recruiters, create content, put yourself out there. Absolutely, Naomi. You got it down pat, girl. Y'all need to listen to Naomi. And then Magdalena says, how can I find an internship program? I would love to volunteer somewhere, but I don't know how to find a company that may offer. So I did my very first live podcast recording ever with Dan Sfera. When was it? A couple of weeks ago now, I think. It's still posted on my LinkedIn profile and my YouTube channel. But check that out because he talks about specifically what you're asking, Magdalena. How do you secure a volunteer opportunity? He gives some great advice, some great tips on that. And then just to answer your question here as well, going back to what Naomi said, you got to put yourself out there. You really do. You got to put yourself out there. So I would start by creating a list of all of your local clinical research sites. So all the sites in your area. And I would call them and let me take a step back. I would go in person first. A lot of people nowadays, especially with the COVID, they're like, you don't want people in person. But I would try to go in person first. If that doesn't work, I would call and email. And I would just let them know, hey, I am and correct me if I'm wrong, but I think you are a international physician, right? I'm an international physician. And I would love to, I'm looking to make a transition into the clinical research space, and I would love to come and volunteer my time with your site. I know there's a study coordinator shortage, and you guys might need some help. So I would love to come and volunteer my time with your site and see how I can support you guys in running your trials. You always want to bring something to the table, right? And not just take. So I would put out that message when you get, or if you get somebody on the phone, ask, can you speak to whoever's in charge, and put that out there and say you want to offer your time and offer your help, your support, and, helping them run their trials on a daily basis. So I would start there, Magdalena, and you'll be surprised. That's actually how I got my very, very, very first experience, was volunteering at a site. And you just start at your local sites and you call. And some people are like, oh my God, there's some people, depending on the area you're in, it might be 100. And they're like, you want me to call? Yeah, I want you to call all 100. If you're serious, you will. So get a list. You'll be surprised how many people are in your area. And then you'll be surprised with how many people are dying, desperate for help. So that's a good place to start. And then Jasmyn, I see your question. Is it possible to personally contact site owners to see what opportunities they have available? Yes, absolutely. Going back to what I just told Magdalena, create that list. If it sounds like you might already have some in mind. If you do, call them, ask to speak with the site manager, the director, because every site is a little bit different, right? Ask to speak whoever's in charge. It might be they might have an HR department. You might need to speak with a recruiter or HR professional, whoever it is. You just ask to speak to that person and let them know, hey, I want to help out. I want to volunteer. And they'll be more than happy. And Naomi, she also, there she goes, dropping more nuggets. Thank you, Miss Naomi. She said, search in clinicaltrials.gov. That is the perfect place, another perfect place to get started, to find sites near you, clinicaltrials.gov, because they'll have all the studies, the active studies that are going on right now, and in your area. So that's another good place to start. Naomi, you're on point. As I said before, dropping nuggets. Thank you, Naomi. And then Laura also gave some great advice too. She said, ask sites if you can assist with recruitment for subjects in the study. Absolutely. That's another great tip, Laura. So thank you for that. You can ask if you can help with recruitment. And not just recruitment, but even marketing, because a lot of people, a lot of sites specifically, they are struggling with recruitment. So that was another great point, Laura. If you even just mention that you'll help with recruitment, they'll bring you in. So those are a lot of great points. Thank you, Laura. Thank you, Naomi. So that's gonna wrap up. Let's see. Do I have any? I don't have any other questions. So we're gonna wrap up today's session. But I'm gonna drop in and you're so awesome, Naomi. Yeah, so I was checking the comments. Okay, so I'm gonna wrap up today's session, but be on the lookout, like I said, for the podcast series that is coming out starting this week. The radical interview series. And for those of you who, even if you haven't gotten to gotten a call back yet or an email or whatever yet, you still want to go ahead and prepare for the interview. The last thing you want to do is wait until you actually get an interview to start preparing. So the time is now. So this applies to you too, y'all. So check it out. Stay tuned. And then other than that, thank you guys so much for joining me. As always, it is a pleasure being here with you guys, answering your questions, being of service. Anybody that has any questions, outside of this, feel free to DM me. I will address them. Other than that, Happy New Year again. And I hope you guys have a great night.